The pandemic has exposed many inequities within our healthcare system, both here in Louisville and across the United States. Black Americans have been more likely to get the virus and then die from the virus when compared to their white counterparts. Dennis Tang is taking a look at the roots of some of these inequities and what people are doing to address them.
Doctors and nurses have been fighting the coronavirus pandemic for more than a year now. For one U of L health physician, he says his mission of providing care and education to underserved communities is more than just a job. It's personal.
I do remember growing up, any issues, any problems you had, everybody had to go downtown to the general hospital.
Growing up in the Parkland neighborhood, Mark Burns says it wasn't hard to see there was a problem.
Healthcare wasn't really emphasized a lot, not until you got sick, and then that's when you saw care.
Now an infectious disease specialist with U of L Health, Dr. Mark Burns is part of the fight against the coronavirus pandemic, which has disproportionately affected Black Americans around the country and here in Louisville.
Being a Black physician, I have throughout my entire medical career have noted that there have been inequities. The thing about COVID-19, it sort of put the spotlight on these inequities.
Part of the problem can be traced back to redlining, a practice started in the 1930s when certain neighborhoods where predominantly Black communities lived, like West Louisville, were deemed to be risky investments, meaning resources like grocery stores, businesses, and health centers were often hard to find. Burns says there's no easy fix. Access to affordable and quality health care is a start, but Burns says many of these issues are connected. Access to fresh groceries, affordable housing, and well-paying jobs are all part of healthcare that have been neglected for decades.
This has been a problem for generations, actually.
Coming up at 11, we look at how redlining left communities without easy access to quality healthcare and what people are doing to address some of those issues caused by systemic racism. In Louisville, Dennis Tang, WHAS 11 News.